So thanks very much, everyone. Really delighted to be with you here today. As Phil has already explained, Parenting for Lifelong Health is a charity that empowers parents to improve child development, reduce violence, and promote mental health. So, as we've just mentioned, I'd just like to start with a brief introduction to positive parenting. Positive parenting, as many of us will know, is a nurturing approach to raising children that emphasizes building a supportive and loving environment. It involves a set of behaviors and practices that focus on building strong, caring relationship with children while promoting their healthy development and their well-being. It focuses on building positive relationships, improving parent-child interactions, guiding children through positive behavior through encouragement, teaching, and understanding, rather than relying on punishment or criticism, and particularly avoiding violent discipline. We promote providing guidance and setting clear boundaries and promoting positive behavior through praise rather than criticism. Positive parenting is all about creating a supportive and nurturing environment where children are able to reach their full potential. And the approach aims to foster a strong parent-child relationship, promote healthy development, and enable children to thrive. As we all know, the big challenge, the big problem that we are facing is that more than 1 billion children are exposed to adverse childhood experiences. And these often result from violence, poverty, and inequality. Adverse childhood experiences have lasting negative effects and lasting negative consequences on child development, on their health and economic outcomes later in life. And evidence shows that parenting support interventions that promote positive parenting can reduce these adverse childhood experiences and promote positive child and family interactions and also positive child and family outcomes. However, these in-person evidence-based parenting support interventions are very resource intensive and very difficult to reach impact at scale. And so Parenting for Lifelong Health has come up with a solution. And our solution is to use technology to enable us to scale evidence-based parenting solutions in order to reach as many families as we can in as shortest time as possible. Parenting for Lifelong Health delivers evidence-based parenting support that has been shown to improve positive parenting capacity, improve child development, reduce violence, and promote mental health. The support that we provide is delivered using digital tools such as apps and chatbots, and this enables us to reach more families compared to in-person interventions that can only be done in smaller groups. For example, we work with an app. We have developed an app called Parent App, which is a free mobile app providing evidence-based parenting curricula. And this can be deployed as a standalone solution or in combination with in-person and remote support sessions. Parent App gives parents the support they need, the skills that work, and trusted advice they can count on so they can protect their children from harms, including sexual violence, and also from violence within the household. Our content is built on 60 years of behavioral science research. And the key is that parents need to first build positive relationships with their children before they can address other risks and other challenges, including those affecting sexual violence. The app is structured around 12 parenting courses, which is delivered via this offline app. And these parents participating learn simple skills, such as the importance of one-on-one time, positive reinforcement, being consistent with rules and routines, non-violent discipline, stress reduction, and mental well-being and problem solving with their children. Parents also learn about sexual violence prevention skills, including adolescent online and offline safety, sexual reproductive health, self-empowerment and defense, and responding to crises. Each module introduces a new parenting skill, demonstrates how to do it through comics and videos, has testimonies from actual parents on its benefits, and provides parents with activities that they can do with their children outside of the app. Parent app delivery is often augmented by human-led support, so it may be provided by trained community workers who provide in-person onboarding to help with the digital literacy and remote WhatsApp support groups for troubleshooting challenges. So by improving positive parenting, learning through play, stress reduction, and equitable partner relationships, our solutions help to reduce violence against children and women, improve parent and child mental health and physical health, and support child learning and development outcomes. Ultimately, this breaks the intergenerational cycle of violence. So positive parenting is associated with numerous positive outcomes for children, including improved socio-emotional development, better academic achievement, and reduced behavioural problems. Research also suggests that positive parenting fosters stronger parent-child relationships and promotes a child's ability to regulate their own emotions and behaviours. Parenting for lifelong health, parenting solutions have been tested through 15 randomized controlled trials in 11 different countries, with 11 more randomized controlled trials currently underway. And this gives us a lot of evidence that our interventions do work. Through positive parenting, our parenting support can increase parental engagement in early child development and learning opportunities. So in a randomized controlled trial of a parenting for lifelong health intervention delivered by preschool teachers via in-person consultations, chatbot messaging, and online support groups, this took place in China in 2024, and group analyses showed that it resulted in a 39.9% increase in parental engagement in ECD learning opportunities. Positive parenting encourages non-violent discipline, and our interventions promote positive parenting lead to a reduction in violence against children. In a study in South Africa that was led by Professor Lucy Kluwer, a parenting for lifelong health intervention led to a 45% decrease in violence against children. And parenting support has also been shown to improve mental health. So a randomized controlled trial of a parenting for lifelong health intervention delivered by public health workers to parents of children aged 2 to 9 in Thailand found that the intervention resulted in a 40% reduction in caregiver depression, anxiety, and stress. And this was caregiver mental health. It's also been found to improve child mental health. This study also found a 58% reduction in violence against children and a 60% reduction in child behavior problems. Our interventions also support parents to keep their children safe. And a very recent randomized controlled trial in Tanzania showed that the parent app that I've just mentioned results in a 57% less sexual violence against adolescent girls by supporting parents to learn how they can best keep their young girls and adolescent girls safe. So our ambition at Parenting for Lifelong Health is to reach 50 million families in the next 15 years. And our interventions, as I've already said, have been shown to increase parental engagement in child development learning, reduce sexual violence against girls and adolescents, and decrease physical abuse against children, as well as improving mental health outcomes. And we've also have lots of feedback from parents that they also really value the support they're receiving and share it widely with their friends and family. They recognize how useful the support is for them and are really keen to pass it on to others. Thank you very much for listening to my presentation.